Tēnā koutou, tēnā koutou, tēnā koutou. Ko Clísim te mauna, ko Creed te rawa, ko Ngāti ko te mana te riwi, ko Iain Matheson tōku ingoa. Ka nui te mihi kia koutou. Tēnā koutou, tēnā koutou, tēnā koutou, katoa. Good morning, everyone. As Dorian said, Iain Matheson. I'm from Scotland, as I've just indicated, from an island off the northwest coast. And greetings to you all. This is my first time in a big room since the lockdown. So if that's the same for anybody else, you're particularly welcome, and nice to see so many familiar faces. And also with COVID, it's a reminder that the thousands of children, families and whānau that are served by these four programs have had it tough over the last weeks and months. And while some of us have had our challenges, they're dwarfed by the experiences that many of these have had. So 2019 and early in 2020, the Evidence Centre published 8 reports on 4 of its early intervention programs. There was one on strengthening families, which I did. There's one on Family Start, a process evaluation on Family Start. There's an impact evaluation that's in development at the moment. 3 reports on social workers in schools and 3 evaluation reports on children's teams. Different questions, different methodologies, different purposes, but a number of themes appeared to be apparent from the reports that were coming through, and therefore I was asked if I could look at these 8 reports and also look at some of the older research that's gone on these programs as well. So I'll do a little bit of context, 5 main findings, and if we've got time at the end, some discussion around implications. Now, I'm not going to fire some heavy definitions at you, but suffice to say, for the purpose of this, whether it's newborn babies or whether it's adolescents, for me, at its simplest, there's 3 dimensions of early intervention. One is whether it's about preventing harm or addressing well-being, whether it's targeted or universal, and whether it's focused on individual children or families and whānau. And it could be anywhere along those lines for any particular program. The 4 we're talking about, strengthening families, established in 1997, is an interagency case conferencing system. It's in place in roughly 2/3 of the country. Family Start started the following year, 1998. That's an intensive home visiting service, long-term home visiting service for pregnant mothers and family whānau with young children. Family Start is a nationwide program. Social Workers in Schools operates across the country as well. That is a school-based social work service for children and their families whānau. That takes place in most decile schools 1 to 3, primary and intermediate, and that's English medium schools as well as kura. And children's teams started out 2012. They cover roughly the 1/3 of the country where Strengthening Families no longer operates, and they focus on those young people and children below the statutory threshold, and it's an interagency program to serve their particular needs. Now I want to talk briefly about why, what and how. There's micro why and there's macro why. Micro I'm not really going to be bothering about because that's historical stuff and that may have all changed. But the macro stuff's around beliefs, why these programs exist, why providers provide them, and why Oranga Tamariki delivers them on a national basis. And it's around children being valued, children, families and whānau being valued and being seen to have strengths and agency. Secondly, it's around the state having a role beyond universal services to support and help families and children and whānau most in need. And thirdly, it's around the power of early intervention. If you're more analytical, that's the kind of description of that you might prefer. In terms of program types, essentially for me, there's three different types of programs. There's a manualized evidence-supported treatment programs, and that's a hell of a mouthful, but that's essentially the sort of evidence-based programs that the expert panel on the modernisation of childhood and family was recommending. These have very particular characteristics. You tend to find them on US websites where they get accredited, and that accreditation is often dependent on US federal funding. So that's the kind of history of them. The other end of the spectrum, you've got what I call local services, and I've contrasted on that slide the different characteristics of the two, and the third is in the middle. It's a blend of those two approaches, and for me, the four programs we're discussing today are a blend of that to try and get the best from the kind of MEST orientation, whilst also having aspects of that local service provision and community focus that is so important. Very quickly, how the programs operate. Look at the bottom, then we have program infrastructure. So that could be national office staff, referral criteria, tools, the information systems, then up top left, the knowledge, skills and experience of the providers and their staff, a very important component. And thirdly, top right, the practice principles. That's how it's been brought to life in terms of the application of the program to the particular situation that workers face, and intersections around engagement, trust and flexibility. And that could be in relation to children, families and family themselves, or it could be trust and engagement around community partners and other professionals. Okay, so moving on to the five overarching findings. The programs are targeted. They're all targeted. Strengthening families requires 2 agencies to be involved, or preferably 2 agencies to be involved. Family Start is particularly for, as I said earlier, pregnant mothers or families whānau with particularly young children. Social work in schools is targeted in relation to the choice of decile schools that it goes into, and children's teams are targeted in relation to the particular area just below the statutory threshold that they're looking at. However, when you look at the aims of the programs, you look at the stories in the reports, you look at some of the statistical data, it's apparent that there are some strong commonalities between those families, sometimes at different points in time, different ages, but they're quite similar. One exception might be Strengthening Families, which appears to be more Pākehā orientated than the other 3, where most of the children families are Māori. So as well as targeting broadly similar families, these programs have some quite restrictive requirements that families need to agree to. So for example, Strengthening Families, you need to be willing to have your personal information shared with other government agencies or NGOs, and to attend a meeting with representatives from those, that is negotiated with you, to discuss your family and to develop a plan. That's not for everyone. Family Start, equally, it's quite an intense program. Initially, it's weekly. It's quite long. It's very long term potentially, and families need the worker to come into their home every week or every fortnight or whatever. So again, some families will go for that depending on the particular circumstances they find themselves in and how they perceive the provider. But again, it's not for everyone, and they're quite focused or siloed programs. They have their own infrastructure. There isn't too much national coordination or local coordination, so they tend to be very, very standalone. So these are some of the characteristics of the approaches and purposes. Now, in terms of design commonalities, they broadly sit in the same area of the service delivery spectrum. Now, as we learned from the Strengthening Families report, within Strengthening Families, different areas could be almost at different ends of that. I think the others appear to be a lot more more consistent. And there are differences, but they're kind of clustered around the middle, and rather a lot of comments across the reports on we need more intensives provision above and we need more provision below. And I think particularly for the two that were coordinating, a lot of comments around, well, we're just coordinating, but there's not a hell of a lot of stuff to coordinate because we're not necessarily getting a lot of support from government agencies, for example. Okay, so they're more or less clustered around that area. They balance fidelity and flexibility. So Family Start was found to have high fidelity in the process evaluation, but it's a balance for all of them. Sometimes difficult to unpick from the reports whether good outcomes were because of strong fidelity or strong flexibility and vice versa. So that's maybe something worth unpicking in the future. Some suggestion of whether the designs were less appropriate for Māori. This question actually was addressed in different ways, in different reports, in different discussions. So what came through quite very strongly in the Family Start process evaluation was the need for more te reo materials. And before publication, Partnering for Outcomes had in fact introduced some materials anyway. But much of that was coming from kaupapa Māori organisations that were used to that way of working. They maybe had whānau ora contracts as well. So their whole sense of how they should operate has possibly changed over the years. There were other discussions about whether the program was or was not appropriate for Māori. So the children's teams, there were quite mixed views on whether the whole model was appropriate for Māori. And others were approaching the issue in terms of being Māori sensitive or culturally sensitive. So there was some strengthening families areas, for example, who said that some Māori prefer us because we're not a Māori organisation, because of whānau and connections in the locality. Others said we can and do put on a kaupapa Māori experience for families if that appears to be what's going to help them and in their best interest. So it wasn't a particularly cut and dried, but there was a lot of discussion. It came through in the social workers in schools kuras as well, similarly looking for more te reo material, and almost a sense that they wanted to evolve that model maybe slightly differently, or maybe have a separate model for the future rather than just a te reo version of the program that is delivered to everyone else. Little common infrastructure, so I kind of touched on that briefly before. 3 of the 4 are required to have local government's arrangements, with the exception of Family Start. I should say all of them appeared to have strong bi-agency or interagency professional relationships in their locality, but this requirement for local governments applied to 3 of them. Strengthening families, 7 of the areas didn't even have a local governments group, and it wasn't, there were some examples of strong local governments, but not that many. Children's teams, the discussion was more around whether the phrase locally led, nationally supported, which was going around at the time, whether that reflected reality. A lot of stakeholders were saying this isn't locally led, and we're looking for much more ability to engage and drive what happened locally than how they felt. Now, I should say the children's teams concerned at just 3. So this was Otaki and Horowhenua, Christchurch, and Rotorua. One old one, one middle one quite recent one. Information systems was another theme that came up again and again. I maybe need to put a caveat around this. I've worked in 3 different jurisdictions, and I've yet to meet social workers who love information systems. It fights against the core of many of them. So I just kind of put that in as a caveat. But there seemed to be a lot of comments about complicated, difficult to use, not user friendly, inaccurate, presumably because the information that went in was inaccurate. But at the end of the day, it wasn't delivering what it was meant to be doing for whatever reason. So people weren't really able to use the information very strategically because people were saying it wasn't that accurate. Therefore, after all this time, effort and money, it wasn't actually helping them that much. The one that doesn't have one of those types of it, and they're all different systems, social workers in schools, they have the strengths and difficulties questionnaire platform. So that's a behavioural questionnaire that usually gets done before and after an intervention. It can be done at other times, and it's maybe done by the family whānau and a teacher. And then there's a platform to record all of that. But there have been some issues with that as well from maybe a different point of view. It's a very clinical type of tool, very prominent in, even in the Pākehā world, it's kind of right on the psychiatry, psychology end of the spectrum. And the language doesn't necessarily fit. It's focused on behaviours, and some people are saying there's a bit of a tension there. There has been a te reo version produced, but because this is an internationally accredited tool, it has been accepted by the publisher, but it's a literal translation in order to comply with those requirements. So whilst there was a comment that it looks positive to family and whānau that this is available in te reo, the actual language was quite alien to people, and therefore there were reports that it wasn't very applicable or helpful. Professional development. So think back to the previous slide where I had the MEST and the kind of characteristics. So back in the day, these programs would have had a sort of national training program to support them. Bits of that do still go on, often regionally, but across all 4 programs, the current arrangements do not appear to be meeting the needs of those that were interviewed across the different programs. So sometimes practitioners would have to find their own training that they thought met their needs. There is a national conference for Family Start, and there are occasional events, I think, for social workers in schools. But Strengthening Families were lamenting back years and years and years and years and years when they last had a national event. So that did seem to be a strong element around the infrastructure. Delivery challenges, salaries, recruitment and retention, maybe equity, but there were reports that it was impacting on recruitment and retention as well. Strengthening Families seem particularly problematic in terms of when they last had a pay rise. So that came across 3 of them. It wasn't really covered in children's teams because those staff were paid through a different route. Case complexity. I think nearly everybody said cases were more complex today than they were in the past. The Family Start one can be clearly attributed to the 2012 changes in the referral criteria. That's what was reported in that process evaluation. But there were also discussions around societal complexities, poverty, presumably society being less equal than perhaps it was in the past, and thresholds. Thresholds, not just CYF, Oranga, Tamariki and CYF, but also other government agencies. So there was a strong sense or feeling that those thresholds had been tightened, and therefore NGOs were getting more challenging cases than 1 they were used to, and 2 that they were necessarily contracted for. Again, Family Start had done some work in that area since that report was published. Service continuity. NGOs are required to ensure there are arrangements in place whenever a member of staff leaves or is on leave. And that seems to work by and large. There were some examples where cases where services were not provided for a number of months. There was one example of a changing providers that led to some disruption, but there doesn't seem to have been any large disruptions reported, as were the case back in 2012, the Family Start, when they got rid of four providers and had another 11 on one-year contracts because of performance issues. But it did come through in other ways. So the children's teams, they were taking, I think it was 10 days to accept a referral, 29 days to allocate that case to somebody. And then in one of the teams, because of a lack of resources, they appeared to prematurely close a lot of cases because they just didn't have the people to serve them. So service continuity can present itself in different ways. And certainly the children's team, people that were interviewed, the family whānau that were interviewed, as I'll come on to say, they were particularly positive, but they were waiting 6, 7, 8, 9 months to get a service. So some program outcomes. All 4 highly valued by those that were asked. I was surprised how positive the children's team one was, to be honest. The majority of family whānau that were interviewed as part of the children's team evaluation described terms that equated to it being transformational. But Family Start, social workers in schools, similarly, some very, very positive feedback, tended to be about the worker, not the program. So that's maybe a useful caveat to keep in mind. Strengthening families, nobody was interviewed as part of that piece of work. We did have feedback forms from those that stayed on for a planned final meeting, but that was a minority of people that participated in that program. And where there were interview sites were involved in the selection of interviewees, so they weren't a representative samples. But nonetheless, some very positive feedback from family whānau and professionals as well. Professionals in these areas all seem to appreciate these particular services. In this round, we've also got a lot of documented stories, and it's nice to see what people appreciated, how family whānau liked to be engaged with, what kinds of issues were being addressed. That kind of detail tends not to come through historically, so that was particularly good to see. There was limited quantitative evidence across these 8 reports, because most of them were either qualitative or mixed with a qualitative bias, perhaps. So it'll be good to see the Family Start impact evaluation when that comes through soon. There are, of course, the quantitative stuff come through from MSD 2016, 17, 18. So we had 3 quasi-experimental design studies, 2 on social workers in schools and 1 on Family Start, and some encouraging, positive material coming through from that, some statistically significant findings. One particularly encouraging result was in relation to sudden infant death. So it'll be useful to see whether that's echoed in the next one. I think that was quite early days in terms of the use of the IDI, and it was quite exploratory, I thought, but it'd be useful to look at some of that material in the light of what's coming through just now. Okay, some broad implications. There's firm foundations. I mean, these programs are welcomed by family whānau, welcomed by professionals. We have staff within this building and in NGOs across the country, and Partnering for Outcomes advisors with up to 20 years experience of developing and delivering early intervention. My caveat is, it looks easy, but it ain't. it's very tricky to recalibrate all of these elements so that they work harmoniously together. And I think if we look back, we can see historically where it has worked and where it hasn't worked, and how learning has had to be continuously applied in a fast-moving environment, particularly around whanaora. Secondly, I'd say there's a common issue around collaborate or compete. There's quite a lot of competition in the current framework. I think there's also some implications around how we actually roll out national programs. Strengthening families, I think, took 5 minutes. Social workers in schools and Family Start, they're nigh on 15 years to get that whole program rolled out onto a national basis. And children's teams, before the decision to transition away from that model, the projections of when that would be fully in place were quite long term. And I think that just makes it very difficult for everybody that these things are moving at such different paces. And certainly for me, one of the messages is that we need to find ways of speeding up this process and having effective programs in place all at one time across the country. Piloting what needs to be piloting, but find ways to learn much quicker than perhaps we've done in the past. And I think the last implication was it does highlight that the provision in many areas feels quite limited. And whilst the likes of Family Start have done a lot of work in terms of connecting that service with universal services, I'm not sure that's been done as much in the other programs. So thank you for listening. Thank you.